So now I'm really excited because I'm going to ask one of the prominent professors of Tom's to have his lecture. So I'm really proud to invite Professor Muhammad Ali Charaqi. This is really long if I have to read his affiliation, what he has done in these uh terms is it's a lot. So, Professor Muhammad Ali Charaqi, Professor, Nursing Management Department, School of Nursing and Midwifery, Tehran University of Medical Sciences, Iran. He's widely known for his philosophical uh uh sorry. Can you hear me? Sorry. I think that there is some problem with the voice.
Yes,
Is
yes,
it
sure.
okay?
Yes. Yeah, yeah.
So, thank you, doctor. Thanks a lot. So I was
Thank you.
talking that you're very professional in philosophy of nursing and so on, and your theory. This is very well known in Iran. So I would like to invite you to start your topic, the role of nursing and midwifery students as health ambassadors in strengthening the four-chamber symphonic belief and practice of self-regulation in home visits to create a healthy environment. We're really glad to have you with us.
Okay. Hello, everybody. Thank you very much for your nice words about me. Thank you. Thank you very much. I'm very happy that I'm here and joining with you. Uh, and the last presentations was very informative for me. Uh, First of all, I would like to extend my thanks, special thanks to all of you, the executive teams and yes, committee. Also, I would like to extend my special thanks to Professor Tekian for his scholarly presentation and other colleagues, esteemed colleagues here. Yes, I would like to present my presentation, my topic, with my special own conceptual framework or theoretical framework in my lens, and this is a connection between my conceptual framework with the topic of planetary health. Uh, as I uh, as I learned from the last presentation, yes, my presentation would be for me would be the maybe useful reflection on thought, speaks, and actions, uh, especially reflection uh, in thoughts, reflection on thoughts, reflection in speech, reflection on speech, also reflection in practice and reflection on practice, especially in terms of planetary health, with my special conceptual framework. Yes, my title is For Season or For Chamber Symphony Nursing and Planetary Health. And the main topic in this schedule is the role of nursing and midwifery students as health ambassadors in strengthening the four-chamber symphonic belief and practice of people regulation in home visits to create a healthy environment. Yes, the origin of my theory, the sum of the assumptions and the premises of my theory. I'm going to speak about it and make some connection between this theoretical framework to the subject of planetary health. Yes, the first region of my theory is interest in Zoroastrian teachings under the title of good thought, good speech, and good actions, and the formation of the importance of the number three in my mind as a framework. Interest in the principle of oneness versus duality regarding light and darkness in the form of dimming or complete light from Zoroastrian philosophy. In fact, thought, speech, and deeds poses four-season symphony, including these four pillars or cornerstones, including intellectuality, intellectuality. This is an abbreviation for generalizability. Uh, Intellectuality, and S for spirituality, and E for ethics, and A for aesthetic. Four-season symphony, including intellectuality, spirituality, and ethics and aesthetics, are toward becoming light, and being empty of them is toward darkness, especially, for example, about this subject, planetary health. If um, when we have thought, speech, and deeds poses four-season symphony, we are toward becoming light. And when we being empty of them about planetary health is toward darkness. Okay. The introduction of four-chamber symphony in nursing, including another assumptions. This theoretical perspective is a conceptual model or framework or theoretical framework. Of course, in the theoretical framework, it is necessary to be designed and developed with grounded theory and another approach. And we are going to these approaches in order to develop our theory in the future. This theoretical framework includes two main structures, two of nursing meta paradigms and nursing pillars. Nursing meta paradigms, as you know, maybe some of you are nurses and maybe is familiar with the nursing context because I think we should in nursing we should think in nursing, speak in nursing, and we should do and our action would be nursing as nursing. Okay, nursing meta paradigms including person, including healthy person and maybe ill person, and another aspect of person is family and community person as a meta paradigm cornerstone. And another meta paradigm is environment and also health and nursing. Also, we have nursing pillars: education, management or leadership, practice, and research. These two main structures also indicates the presence of traces of the number four as another framework or cornerstone in my conceptual framework. Okay, self-symphony or self-regulation and symphonic or single voice is another assumptions premises in my theoretical framework in the action interaction of nursing meta paradigms, as we mentioned, including health, environment, nursing, and person. In terms of structural and semantic consistency of meaning, FSSIC, and form. In fact, generalizing the theoretical and practical content of planetary health in a student's curriculum, including meta paradigms, in order to have single voice in our thought, in our speak, and also in our deeds and action. And self-symphony or self-regulation and symphonic single voice in the action interaction of nursing pillars in terms of a structural and semantic consistency of meaning, as Ms. Bahar mentioned, the resistance of the maybe teachers and the lack of knowledge in our curriculum. And we should have this consistency between a structural and semantic consistency of the meaning in our nursing pillars in education, in research, and also in management and in practice, generalizing the theoretical and practical content of planetary health in these pillars. Yes, Also, we should have a harmony of form and meaning in action interaction within nursing method paradigms with a view to the content and function of planetary health in the student education program, especially in home visits. For example, in clinical placement, in the clinical settings, in hospital settings, for example, in the patient education and family education department, also in community fields, especially in home visits, in community health clinical placement. Harmony of form and meaning in action interaction within nursing pillars, as I mentioned before, and harmony of law. For me, the composition of spirituality, ethics, and aesthetics related to law, the law of the planet, for example, law of any subject, okay? Harmony of law and wisdom or intellectuality in nursing pillars and nursing method paradigms as regulators, as something to stimulate us to be consistent in our thoughts, speech and actions. For example, at the moment, as I mentioned at the first, reflection on practice, reflection in practice. For example, with a view to the areas of planetary health, namely water, air, food, soil, and the environment. Okay, another dimension and properties of my theory is it is as a conceptual metaphor, including four pillars, four modes, four steps, means I see. And the elements including intellectuality, intellectuality, being wise, rational, and wisdom, and using wisdom, rationality, being wise in the nurse's thoughts, words, and actions. For example, on the health of the planet in home visits by students and educators. Okay, using the capacities of partial intellect, including five senses, and general intellect or general analogies or comparisons and deductions with the lens of four-chamber symphony. For example, is it form of energy consumption in homes is wise or not? Where are the gaps and why things should be done to fix things? This can be done by students, by the educators, and by the people as for regulation, for self-regulation. And spirituality, as for spirituality, semanticism and searching for meaning in the nurse's thoughts, words, and actions, in connection with reaching inner peace with self, other, existence, and creature of existence. For example, in this form of energy consumption in homes, is it spiritual or not? That is, does it bring inner peace and tranquility with oneself, with others, with the environment, and with the creator of the planet? Where are the gaps and what spiritual work needs to be done to fix gaps? And ethics, moral principles, including moral principles, bioethics or nursing ethics that govern a nurse's thoughts, words, and actions of professional conduct, and nursing pillars or meta paradigms in terms of content and structure and form. For example, ethical decision making in the context of four-chamber symphony nursing pillars or meta paradigms in terms of planetary health can be questioned with this example. Are the ethical aspects of this form of energy consumption in relation to social accountability and social responsibility respected? What ethical actions should be taken for these options? Last dimension is aesthetics, the branch of philosophy that deals with the principles of beauty and artistic taste in terms of beauty and sublimation in nurses' thoughts, words, and action in nursing pillars or meta paradigms. For example, Niusha have his MS degree dissertations in nursing management and leadership in lens of aesthetic, and have some publication in this area. For example, what are the aesthetic aspects of this form of energy consumption in relation to social accountability and social responsibility? What aesthetic work needs to be done for the bricks? Okay, we can have this conceptual framework in the real world in order to do some self-assessment or peer assessment in terms of symphonic situational analysis of for multiply 3, as I mentioned, these two numbers as a main structure in my conceptual framework in nursing context. For example, self-evaluation, self-interpretation, self-criticism, and ultimately self-control and self-management in the roles of nursing pillars or nursing roles, especially with a focus on the health of the planet, with the lens of a four-chamber symphony in the dimension of thought, speech, and action, i.e., 3 multiply 4 analytical approach. In fact, we can ask from ourselves what I thought, have thought, think about the pillars, meta paradigms of nursing, especially with a focus on the health of the planet. Is it intellectual, spiritual, ethical, aesthetic, or not? Four-chamber symphonic thought. And what I said, have said, say about the pillars and meta paradigms of nursing, is it intellectual, spiritual, ethical, aesthetic, or not for chamber symphonic speech? That means we are going to have reflection on practice, reflection in practice. What emerged, has emerged, is emerging from my actions in the pillars, meta paradigms of nursing, especially with a focus on the health of the planet. Is it intellectual, spiritual, ethical, aesthetic, or not for chamber symphonic action? And also we can have another scanning from ourselves. Symphonic in the name of symphonic situational analysis of 66 multiply 4 in the organs of a nurse or midwife or people or nursing students and midwifery students in terms in title of to be keen, to be smart in terms of four-chamber symphony, and including to be keen eye. What I saw, have seen, and see, especially with a focus on planetary health in home visits, is it intellectual, spiritual, ethical, and aesthetic, or not? Symphonic, keen eye. And another aspect, another organ is keen ear. What I heard, have heard, and am hearing, especially with a focus on planetary health in home visits, is it intellectual, spiritual, ethical, and aesthetic, or not? Symphonic, keen ears. And keen language. What I said, I have said, and I say, especially with a focus on planetary health in home visits, is it intellectual, spiritual, ethical, and aesthetic, or not? Symphonic, keen language. Also, keen heart. What the feeling of my heart has shown and shows, especially with a focus on planetary health in home visits. Is it intellectual, spiritual, ethical, and aesthetic, or not? Symphonic, smart heart. And another one is keen limbs, hands and legs. What emerged, has emerged, and continues to emerge from my hands and working, especially with a focus on planetary health in home visit. For example, throwing the garbage to the water, for example. Is it intellectual, spiritual, ethical, and aesthetic or not? Or burning the garbage in the neighborhoods, for example. Symphony, smart limbs, and keen mind. What passed has passed and is passing in my mind, especially with a focus on planetary health in home visits. Is it intellectual, spiritual, ethical, and aesthetic, or not? Symphony, keen mind. And my definition, special definition, just in nursing, just for your information, as nurses, I'm saying, nursing is knowledge and know-how of a four-chamber symphony consisting of intellectuality, spirituality, ethics, and aesthetics in diagnosing and managing the potential and actual problems of the client in the biological, psychological, social, spiritual, and cultural dimensions at the three levels of primary, secondary, and tertiary prevention. Okay, now we can go to planetary health and nursing and midwifery duties, the connection between my theoretical perspective and planetary health. Yes, planetary health is a concept that encourages evidence-based policies to promote human health, as you mentioned in previous presentations, and prosperity while preserving the environment that allows us to thrive. We have a slogan, I think WHO slogan, our planet, our health, maybe 2023. Yes, we have a good poem from our great poem Sadi. I would like to say in Persian and also in English. ابر و مه and I say خاک. ابر و باد و مه بی خاک و خورشید و فلک در کارن تا تو نانی به کفاری و به غفلت نخوری. همه از بحر تو سرگشته و فرمان بردار. شرط انصاف نباشد که تو فرمان نبری. It means this Persian poem as a proverb. Clouds, wind, dust, sun, and sky are at work so that you can get a piece of bread and not eat it carelessly. They are all devoted to you and obey you. It is not a condition of fairness that you do not obey. And I think this is a good translation for planetary health in order to have reflection on practice, reflection in practice. Okay. I'm going to my last words in the form of conclusion from my personal theory and planetary health. Nursing and midwifery students and their instructors, teachers, professors, as ambassadors of planetary health, should consider the following. One, consider their self-regulation based on the four-season symphony approach. For example, in their daily living activities, in the view of planetary health, for example, regarding to food, water, and energy consumption, and so on. Okay. Two, while updating themselves with the content and principles of planetary health, conduct a review of the status of home and neighborhood visits used based on the four-season symphony principles. And three, while applying the content and principles of planetary health in their intention programming community health and home visit, prepare and present suggested measures based on the four-season symphony in order to make self-regulation, self-assessment in the people, in the client, in home visits, for example, in order to stimulate them in order to think about their thoughts, speech, and actions about the behavior against planetary health and environmental health, for example. Also, nursing and midwifery students are trained, as you know, just for your information, and maybe you know, nursing and midwifery students are trained in about 4 theoretical units. Each unit is equivalent to 17 hours. 8 internship unit in clinical settings, and in the health field, also in community health nursing. Each unit is equivalent to 8 days of 5 hours of presence in the clinic or field in individual, family, and community health courses. This is a good capacity, good opportunity in order to follow the content and structure of the planetary health in order to have a good health. Some of the topics are home visits and health assessment of the individual, family, and living environment, as I know in the community health nursing, including community health nursing 1, 2, and 3 section. Some of the topics are food hygiene, healthy nutrition, and therapeutic nutrition, breastfeeding, environmental and community health in urban and rural communities. There is a need to include the literature and principles of planetary health in the revision of the curriculum for undergraduate degrees, which has been the subject of our discussion here, as well as master degree and doctoral degrees in nursing and midwifery. And some another recommendation for capacity building and readiness for behavior change. In terms of respect for food, healthy and natural nutrition instead of fast and processed food, and imbalance between the 4 food groups, etc. Respect for water, not overusing water, taking water shortage seriously, and modifying consumption patterns, not allowing household sewage to enter running water in neighborhoods, for example. Respect for soil, keeping the soil and land clean by preventing of entering of chemical and plastic waste into the environment. And also respect to air, reducing the use of fossil fuels, modifying energy consumption patterns such as gas and cooling and heating systems, and replacing public transportation with private cars. Above-mentioned domains as the main alphabet of a healthy planet and a healthy environment should be subject to intellectual, verbal, and behavioral capacity building. Of course, the latter should also be considered in macro, meso, and micro context level policies. Effective capacity building requires short, medium, and long-term programs in the field of readiness for behavior change, including 5 stages: pre-contemplation, contemplation, preparation, action, maintenance, in home visits by nursing and midwifery students as health ambassadors, which should be designed, implemented, and evaluated. And curricula should include topics on planetary health. Nursing educators and trainers should be empowered in this area. Yes, and the last words, some last general recommendation. During World Health Week, we should, everywhere we have this day and a week in order to focus on the healthy issues in our country in line of the World Health Week. During World Health Week, we should hold scientific meetings and numerous campaigns on the health of the planet. We should hold appropriate meetings with local politicians, municipalities, and members of parliament to sensitize them to the issue of health of the planet, for example. We should focus on citizenship as a citizen who is friendly to the health of the planet from childhood, focusing on philosophy for children. Maybe you know, philosophy for children in order to have self-regulation, including intellectuality, spirituality, ethics, and aesthetics in the behavior against planet health, food, water, and so on. As an appendix, we should include the health of the planet in the curriculum of preschool, elementary school, middle school, high school, and university to create appropriate ambassadors for capacity building and behavior development for the health of the planet. We should also include topics related to climate change, environmental health, universal health coverage, and sustainable development goals, SDG, in the theoretical curriculum and internship. We should include the health of the planet program in the theoretical curriculum and internship of health courses for nursing and midwifery students. Yes, this is the last slide indicates me and my colleagues, my friends in my climbing that unfortunately indicates air pollution in the mountains, and we should regulate ourselves in order to have a good environment for eliminating of the air pollution and other things affecting our healthy planet or planet of health of planet. Thank you very much. It's over.
Professor Charaqi, thank you very much for your amazing presentation on four-season chamber symphony in nursing and planetary. It was really fantastic, Professor, and I really enjoy this presentation. You highlighted about self-regulation, that our nursing and midwifery students could consider self-regulation and self-criticism as ambassadors of planetary health. It was a brilliant idea, and I want to share my own ideas that I think self-regulation requires self-awareness and also self-compassion. By considering and by having self-awareness, we could be able to have the sound regulation and the sound criticism. Also, you offered some recommendations on capacity building and readiness for behavior change regarding the planetary health. I want to say that actually nurses and midwives have a pivotal role in this field because of their enormous potentials and their professional field. They could be very effective in this way. And also we know nurses and midwives as a professional health changer because I think because they are highly respected in the society and highly trusted in society. Also, they have expertise in communicating complex information with the society, and they have a strong history of professionalism to find solution for complex situations, and they could be very creative in this field. Thank you very much, and I want to express my sincere gratitude for accepting our invitation. Thank you, Professor.
Thank you. Thank you very much for your recommendation and complimentary recommendation. Thank you very much. Bye now.
Thanks a lot, dear professor. I really enjoyed your informative lecture. It was an honor to audit you. So I just received an interesting question from one of your students who's present in the council. So she says, as an ethical fact, a nurse is an advocate to peer people in practice, and she wants to know that you, as an expert who have experience in four pillars of education, research, leadership management, and practice, can you add another P to those three P's, for example, peer, people, practice, and the planet?
Yes, thank you very much for your good question. Yes, as I said, I like say a poem from Maulana, and you can translate it. مولانا says در درون سینه شرحت داده ایم، در درون سینه شرح دادیم، شرح اندر سینه‌ات بنهاده ایم. در نگر در شرح دل در اندرون تا نیاید طعنه لا تبصرون و فی انفسکم افلا. Okay. This means we should have self-assessment and peer assessment, maybe 360-degree evaluation assessment, and there is a relationship between personal self and social self. Personal self and social self. There is a relationship between an action, interaction between self and social. Okay? And there is a connectedness between mind, I, and me. Mind, I, and me. We are going to stimulate peoples. Okay, the person, the peers, and the community, in order to focus and have reflection on their thoughts, speech, and actions in their assertion, in their claims, and their action, in order to have a close relationship between their claims and their activity. Uh, yes, we are going to just, as I mentioned, we are going to have a citizen who likes the planetary health, who likes their environment, in order to have a good health for example, with philosophy for children, philosophizing, thinking about their thought, their speech, their actions. And yes, we say amr be ma'ruf nahy az munkar. Okay? And we are going to have, for example, in social um, support, in social support, we have three dimension: informational support, instrumental support, and emotional support. And these supports would be between people together in order to have a good situation.
So, thanks a lot for your answer. One of our audience has a question. I think it's really long and we should divide it into three parts. She said that
Mhm.
how does competing needs such as workforce, resources, and patience. So let me ask it once more. Sorry for disruption. How does competing needs such as workforce, resources, and patient impact the development of policy? This is the first part of our question.
Yes, they can give their for example, and they can ask their concerns, expectation from the for example, from the health agents, professionals, in order to give them information. Also, the students, for example, the schools, faculty of nursing and midwifery can send their expectation to the university, and university send them to the health ministry in order to make some policy making regarding to the concerns.
Thanks a lot. The next part, she says, describe any competing needs that may impact nurses and midwives' burnout.
Pardon?
So I'm going to repeat it again if there was any problem in the sound. Please describe any competing needs that may impact nurse and midwives' burnout.
Yes, yes. For example, nursing shortage is limiting resources, and maybe don't hearing of the nurse's voice in order to make some new policies in the ministry, in the university, maybe in the schools. This is a burning agent, for example. Uh, yes, um, we should focus on the expectation of the health professionals in order to make to get some recommendation from them just in order to have a good health for the people. We should advocate, as you mentioned, advocate for advocacy for people in order to sublimate their health position, health condition.
Thanks a lot. And the third part, she says, what are the impacts and how those impacts might policy address? I think she meant that what are the impacts in policy making that can have an effect on competing needs in Iran, for example. I'm not sure if you understood her question well. So I think that you talked about policy making a lot, but I would like to ask you to add some more points if possible.
Yes, the direct response can be the eliminating of um, paternalism, paternalism, paternalism in health system can be the main response in order to eliminate any limitation to participate all of the professionals in policy making in the health in Ministry of Health and respect to nurses and midwives for in terms of they are they can be uh, um, change agents.
So thanks a lot. It was really informative. I'm going to say a huge thanks on behalf of all the audience and especially me because I really enjoyed your lecture. Thanks a lot, everyone. So this is the time for
Thank
lunchtime
you very
break.
much.
So 30 minutes later, we're going to have you back. So have a nice time and I hope to see you back fresh and up.
I want to now introduce Laura Liebau. Laura is from MedMissio Würzburg, and she holds a bachelor degree in physiotherapy and a master degree in public health. She works for the Institute of Global Health at MedMissio and is a project lead for an online library for health professionals. But she will share more information in detail on her work called MedBox.
All right. Thank you for the introduction, Sabine, and for the possibility to speak here at the summer school. Yeah, I don't want to confuse the Planetary Health Education Toolbox with the Planetary Health Toolbox that I want to present to you today. It is a little different from the project that Eva Maria showed you earlier, but you will see the differences in a little bit. So This is my table of content today. I will show you and introduce you to our Medbox project very briefly, and then show you the Planetary Health Toolbox, which is part of the Medbox project. And then at the end, I will give you a short practical guide through the database. So the idea for the Medbox was born after a severe earthquake in Haiti in 2010. And this humanitarian crisis called for immediate response. And our humanitarian aid workers in the field found that up-to-date information and guidelines were difficult to find, and that searching for them was very time-consuming. We also found that the number of freely accessible publications for health professionals in general has increased greatly in recent time. But the focus here tends to be on the situation in Western countries, or it is very time-consuming to find a good quality-proofed and practical information for low and middle-income countries. So Googling can provide many results, and these must be checked individually. And this is the time-consuming part, right? So the Medbox team checks publications and all our published documents on our database as are intentionally recognized. They're standards for medical care, they're reliable, and they're unbiased, and we check them all by hand. So to summarize, sorry, or I go further with the Medbox and how it looks like and how we started the Medbox in 2013 after the whole process of collecting data and documents. We started with 6 categories: the key resources, clinical guidelines, women and child health, pharmacy and medicines, training and WASH. And right now, the layout looks a little different. Since these original categories have been further extended, they have been newly arranged, or they have been expanded and put into toolboxes, which are the most important feature of our Medbox. We have 21 toolboxes right now, and the most recently published toolbox is the toolbox, the NTD toolbox, the toolbox for neglected tropical diseases. So our toolboxes provide a quick access to specific documents on a particular topic or context, and they have been created in response to a specific crisis or disaster. The aim is to facilitate user search and provide relevant information as quickly as possible. And last year, we have published or launched our Planetary Health Toolbox. And the Planetary Health Toolbox was created in response to the long-known but further escalating climate crisis, and the man-made climate change has a major impact on human health. In the development of the Planetary Health Toolbox, the particularly big challenge was going beyond the human health aspects that we are focusing on, and gather data from a variety of scientific disciplines. So we then developed the Planetary Health Toolbox with an expertise from a interdisciplinary team of medical doctors, public health specialists, and also in collaboration with some organizations like the German Alliance of Climate Change and Health and the Planetary Health Alliance. In 2021, we then mainly searched for articles and sorted them all by hand, and then we could publish the toolbox in 2022. We started with about 650 documents that we were able to find, and we subdivided them into 9 categories. Right now, we have over 800 publications in our toolbox. The categories of the Planetary Health Toolbox are more general, like the guiding documents, climate change, health consequences, good practice examples in training and education, and we also have more specific categories like documents about the planetary boundaries, food and nutrition, One Health, and green and healthy living. We publish not only scientific work, but also, or especially, educational material in different languages, clinical guidelines, country-specific documents, reports and evaluations, and statistics. So our focus is not on scientific publications, but more on the practical part of literature. We also publish or gather information such as posters and flyers and infographics or video clips for the population and the communities. Our target groups and our users are health workers and humanitarian aid workers, but also scientists, advocacy and political decision makers, NGO workers, lecturers and students, and also the civil society. So to summarize, the Planetary Health Toolbox contains basic documents on the most important topics with a high practical relevance, and they also extend beyond human health issues. We are constantly collecting more high-quality literature to keep the toolbox up to date. We take opportunities to promote the toolbox as a resource in student education or training for practical assignments in the Global South. And we regularly publish issue briefs on current important topics. I will tell you about this a little later. And we would also like to expand our cooperations with experts, networks, and NGOs worldwide. So now I will show you a little practical guide to help you navigate through our website. And we'll start with our home page. So if you enter medbox.org, you can see this homepage here of us. You can see a gray rounded section with 8 round icons on the top. Those are the different categories, and on the right side you see the toolboxes. You can also see a menu right above from the categories. Here you can log in through my Medbox account. I will tell you about this a little later, and you can learn a little bit more about us. Also, here in the gray field, you can see the search area where you can also perform an advanced search. In the lower part, the white part of the website, you can see latest news and latest publications. So if you now go on to the toolbox field, you can see the Planetary Health Toolbox in this picture on the right, on the left far side. And here you can access all our toolboxes. As you can see, they have either a context theme or a disease theme. So they're a very huge variety of topics here. So if I now click on the Planetary Health Toolbox, I see this structure as I showed you before, and I will now give you a quick overview of how you can search for documents. So if you now click on the clean air field in the green and healthy living category, you will then find an advanced search bar again, and you can filter options like language, country, or literature type. And here you can see what you can do with the literature that you found. So in this example, you can view the PDF, you can download it, and you can put it to my Medbox. In this example, you can go to the external link because there's no PDF available. That might be because it is a video link or a website. So now I will show you a little bit more about the My Medbox function, because you can use the My Medbox account to create your own little toolbox if you are interested in a very specific field. For example, you need to register to My Medbox, but you won't be charged with anything. Your data is protected, and you're not going to receive any commercial advertisement or something. So it is just important to save your folders that you're going to create. You can, however, put in some more information if you want. This will help us in the Medbox team to get a more accurate picture of our users. But this is not necessary, so you can fill it out, but you don't have to. So if you go to the My Medbox field, then you can create your own toolboxes. In this example, I have created a folder called Planetary Health and a folder called Child Health in Indonesia. These are the most interesting topics for me. In this example, and if I go now and search for planetary health topics, or in this specific case, I have searched for climate change and health, I can now add documents to my Medbox via this topic right here. So if I do this, another window will open, and I can select my folder that I have created earlier. And now you can see that my document is added to my personal planetary health. As I briefly mentioned before, we also create issue briefs ourselves. Those are some newsletters, or they are similar to newsletters where we collect documents that you can find on our website, and we will give you a little bit more information about certain topics. And this is something that everyone who is registered to Medbox will receive. So, for example, this is the climate change and heat and the impact on health issue brief. And for next year, we are planning a series on climate change and health, and those series will also cover topics like clean air and health, waste management, AMR, and more topics. So I also want to quickly promote our YouTube channel, where we have a really beautiful little video about Planetary Health Toolbox. And if you want, you can just go to YouTube and type in Medbox, and then you'll find our little channel. So yeah, that's my presentation. Thank you for your attention. I'm very excited to see where this goes today. And if you have any questions, I will be very happy to answer them.
Hi everyone, welcome back. I hope that you're freshen up. We're going to continue panel 3. So I'm going to ask Ms. Melvin Otieno, who is an assistant lecturer, School of Environmental Sciences and Natural Resource Management, University of Eldoret, Kenya. She's also a PhD candidate in MLU University, Germany. And she's also the founder of Planetary Health Eastern Africa Hub. So that would be a great pleasure for us to have you as the moderator for the rest of this panel. And the floor is all yours. And if you need any support, we're here for you. Don't hesitate to ask. So over to you.
Thank you so much. Special thanks to Baha for sharing this event idea through our Sophia Summer School program. And I'm really glad to be part of this implementation journey for the conference. And many thanks to the staff and conference organizers of Tehran University of Medical Sciences for offering me opportunity to support this conference as well as moderate the session 3 of today on advancing planetary health, communication, policy, and resilience in practice. So just to highlight and mainly emphasize on the initial speakers during the start of the conference, we've learned that health professionals, including the midwives and nurses, are key people to achieve the Sustainable Development Goals through the Planetary Health Framework. So in this session, we are honored to have Selina Schultz. She's a medical student pursuing her master's in sustainability sciences at University of Graz in Austria, and she'll be able to present to you the topic of planetary health and communication, specifically from words to impact, driving planetary health through communication. So she will be able to share with you and highlight to you her experiences in this topic, so that we can be able to develop science communication approaches that are adequate for the wicked problems like planetary health that convey the complexity and uncertainty for the science process, while offering strong engagement and pathways for action. So I welcome you, Selina, to carry on with your presentation. Thanks.
Thank you for the introduction. Can you all see the presentation already? And can you hear me well? Yes?
Yes, we can hear you.
Okay, and you see the presentation as well, right?
Yeah.
Okay, so then, hello everyone. My name is Selina Schlund. I have a background in communication and sustainability science, and I'm currently enrolled in medicine at the Medical and University in Graz, which is in Austria. And I'm very happy to be part of this conference and to spread the knowledge about planetary health around the world. And for this conference, like Malvina already said, I will be covering the aspects of communications. So here is the outline. So I will be talking about the role of planetary health for communicating climate change. Then I will introduce to you the topic of target audience. And I have summarized the most powerful communication principles for you as well. And in the end, I will show you how to build an awareness campaign for planetary health with communication. So in communication science, they say that people behave according to their values and attitudes. And looking into environmental behavioral science, surveys from federal environmental agencies, they show that a high environmental awareness amongst like they show that that's already existing, a high environmental awareness among society, but only a few are really acting sustainably. And this is called the attitude behavior gap. So the question is, what is the missing piece and what prevents people from behaving sustainably? And how can actually the communication about planetary health can help to bridge this gap? And the answer actually already lies in the field of planetary health, which can engage people on a personal and emotional level, because the topic of planetary health is directly related to people's own lives. So let's say to their personal health, to the health of family, to their animals, garden, the food they're consuming. And to make an example here, just ask yourself, that what is for a pregnant woman more relevant for her current life circumstances? Is it the information that rising temperatures threaten the habitat of polar bears, which is often discussed in the climate debate, or if rising temperatures can increase the risk of premature birth? And I think from this example, you can see that once an issue is discussed on that personal level, meaning it directly affects someone, people are more likely to take action. And actually, just through the knowledge about planetary health, we're already equipped with such a strong toolkit to communicate effectively, because the speeches, they are already informing about health benefits, or even health risks. And exactly this, informing and raising awareness about health risks, can increase the willingness to take action. And there's another important point, because it is said that especially health professionals, they play a unique role in helping to understand climate change and to engage the public for supporting climate change due to many reasons. And those reasons are that they are acting directly with the clients in this field of health, and they are a trusted community voice, and they are, of course, acting as a role model for society. Yeah, and I hope this already motivated you to become a communicator for planetary health, but maybe you're still asking yourself, how can I communicate effectively with my audience? So when it comes to effective communication, the first thing you will always hear is that you have to align your message to a specific target audience. So what is a target audience? A target audience is basically a group of people that share similarities. And in the case of health professionals, those can be patients, clients, colleagues, peers, members of your organization, politicians, friends, family, or even your followers on social media. And for each of those potential groups, you have to analyze and find out their characteristics. And by characteristics, I mean psychographic, demographic, and socioeconomic characteristics, which are then you have to analyze what are their needs, what are their values, what is their lifestyle, what is their opinion about a topic, why are they motivated about the topic. And then, of course, the place of residence, the age, and the gender does affect what they're interested about, as well as their level of education. And here I would like to make an important point, because what I often encounter is that the urgency of the climate crisis wants to reach us as many people as possible. But you have to understand that a message that is equally relevant to everyone is often too general and fails to truly connect or feel relevant to the individual's lives. So you're the most powerful in communication when you focus your speech on a specific target group, because the maximum impact doesn't come from reaching the most people, but from reaching the right few. Okay. So, and here I want to highlight 8 powerful principles for communicating planetary health. So the first is keep your message simple and also use simple knowledge, because the more difficult it gets, the less the target group will in the end follow your talk. So always stay within their motivations, their concerns, and the level of education that you analyzed before. Then repeat your message often. And this doesn't just mean repeating your core message at different points throughout your communication, your presentation, but also talk about widely discussed topics, because the more often people are exposed to a message or to a topic, the more likely they are to talk about it. So, and just to make an example here, is that heat and heat waves, those are topics that are very often discussed. Then focus on human health, because unfortunately, even though of course it's very important to talk about the environmental health effects, those are unfortunately often too abstract for people to understand, as they cannot just feel it personally. Then focus on your region, because the effects of climate change, they differ vastly from region to region, and they are depending on your community's location, the infrastructure, and so on. And then the 5th point, give concrete examples on how they can protect themselves and how they can act sustainably. And this is important for them to have a guideline for them, what they can do. And this also reduces them for them the feeling of being overwhelmed or anxious. Then let them know about co-benefits of sustainable action on human health, which is you can talk about active transport, plant-rich diets, or protecting green spaces. And then the seventh point, emotional connection between you and your audience. Because emotions, those are such a great tool to change even a behavior. And emotions mean not just a touchful way of speaking, but also to come up with a personal story or maybe your motivation so that they can connect with you better. And last but not least, don't use negative words, but positive actions instead. Because in communication science, there exists the concept of apocalypse fatigue, climate fatigue. And it's because negative and threatening messages, or even the word climate crisis, they don't really motivate people to take action. They rather lead to being discredited. But of course, it's hard for the field of climate change to just talk about it in a positive way. And this is why, even if you talk about the negative aspect, it should always be paired with a solution. And I've brought an example for you. So this quote is from David Attenborough. He's a British biologist and broadcaster. And the quote is, saving the planet is no longer just a scientific challenge, but, and I changed that to communication opportunity instead of communication challenge, just to focus on motivating people to act. Okay, then we're already at my last part, how to build an awareness campaign for planetary health. And I want to talk with you about the steps to get there, which are 5 steps. The first one is you have to define your goal, then to analyze target audience, and after that, adjust the goal to your target audience. After that, you can choose the communication channels and then be creative and create the content. So how does this look in practice? So let's say that I want to give a lecture about planetary health at the university. So my goal is to generate awareness for that. So I want to make an awareness campaign about it. In the second part, I go into the target audience analysis. And I ask those questions. Who do I want to reach? What needs and problems do these people have? And what kind of information is this audience actually looking for, and what interests them? So here is how I then, after I analyze this group, define my target audience. So my target audience are health-conscious students aged 18 to 25 who study at the University of Graz in Austria. And besides health, they are interested in sustainability and social justice and would like to combine these areas in their future careers. But however, they don't really know how to get there. They enjoy outdoor sports, use their bicycles to get to university, and they like to discuss sustainable topics with friends, and often by having a vegetarian meal at the university cafeteria. So this text-based definition of the target group will always be the basis for upcoming steps. And now what you have to do is to create a connection between yourself, your knowledge, and this target group to adjust the goal that you made earlier accordingly. So I revised the goal, and now my new goal is to raise awareness amongst the student at the University of Graz about the introductory lecture on planetary health. And this lecture will not just bridge the gap between environmental and human health, but also aim to inspire them to pursue careers in this field by highlighting career opportunities. So why am I not just giving a lecture about planetary health and that's it? It's about my target audience, who I defined as students who will soon be looking for meaningful jobs. So the lecture connects both aspects. It's making them aware about the scope of planetary health, and on the other side, provides them to a solution to their current challenge in finding career opportunities, as the field is very diverse. So now back to the steps. The fourth step is to choose the communication channels, and it's basically spreading the message. And for that, you have to choose places where your target audience is likely to be, because the closer you are to your target group, the greater the chances are that your message will reach them. So what I always do is I am focused on online media, print media, and then on-site. So for online, for this specific goal that I have, I thought about connecting with the social media team of sustainable groups at the university to share the lecture on their existing social media pages, because they already have the followers who are interested in sustainability and environmental health and so on. Then what you could also do is to advertise the lecture through an university email distribution list that maybe also already focuses on sustainability or on possible career paths. And then another option could be to post a brief promotional text on the career counseling website at the university, or to distribute flyers at a counseling center even. For print media, you could place flyers on tables at the cafeteria, and also possibly put up posters near the food station. And of course, because I told you before that the target group is going with a bicycle to university, you could put up signs for the lecture near the bike racks. Yeah, and on site, you can, of course, distribute the flyers personally in front of faculties. So in Graz, it's, for example, the Faculty of Environmental System Science, so which is important because then now you can talk to the people who are already interested in environmental issues. And what you could, for example, also do is to ask professors from the faculty to promote your lecture at the end of their lectures. Then you can also directly talk to the students. Yeah, and after you actually decide what and where to do, you're ready to start and be creative and start the content. Yeah, and now at the end, I just want to highlight the key takeaways that I want to give you from my presentation. So those key takeaways are: just be creative in what you're doing and try to reach people's emotions, and use messages that are easy to understand. And always tailor your message to the target audience for having a greater impact on them. And to motivate people, don't always talk about the climate crisis and negative things and threatening messages, but rather the solutions and the positive sides, and give examples and a guideline about what they can do. And of course, use your role as a health professional, which is really a unique role because you can talk very deeply with the patient and go very personal for their health issues. And then, of course, go from a health professional to a planetary health communicator. Yeah, that was my presentation. I hope you like it. And if you have any questions, just reach out to me here already, or you can, of course, send me an email how you feel better. Thank you.
Thank you so much, Selina, for that wonderful presentation on communication and planetary health. I welcome the audience to share any questions in the chat box if there are any. Otherwise, in the meantime, I have one question for Selina based on her presentation. And you've talked more about the target group for the communication. It can help really the educators, or mainly people, about planetary health impacts or the impacts of climate crisis, for instance. And my question is, what are some of the implications that can offer really a practical guideline or guidance for the effective climate change communication, for instance, specifically to policymakers, as well as people from business and the industrial sector? Because we know very well planetary health is interdisciplinary, but we are bearing the burden of communicating climate change only to the public or the audience or students, but we are not really strategic on how can we communicate our findings to the policymakers as well as the business and industrial sector. So could you maybe mention some of highlights on how we can approach this? Thanks.
Yeah, of course, as I also highlighted in my presentation, it's not just, of course, students and colleagues you can reach through communication, but of course, to really have an impact of the problems of climate change, it's important to reach, like you said, politicians and business owners, as they have a huge power to do so. So, for instance, what you could maybe do for reaching out to business owners is also offering them to give a talk for their employees about the topic of planetary health. But then you have to like really think about, okay, what is the philosophy of the business? What are they even producing, and then connecting it to it. So I don't know, let's say it's a producer of a certain drink or so on. Then you have to analyze, okay, why is the consumption of water and so on important, and what does this play a huge role also, and how they can maybe also have a positive impact with their business on society. And the same as with politicians, you have to think about what is their motivation in politics. When they're already interested in protecting the environment and so on, then of course it's easier to reach them, and it should be the main focus, and your communication will be different as to parties when they're not really into the topic. So you have to really analyze each political party, each politician, each business owners to actually get an answer to that. I hope I answered.
Yeah, thank you so much for that comprehensive answer. And maybe because of time, I don't see any question in the chat yet. So in case there are any question, you can just follow up with our speaker. She's still online with us, so that we can welcome our second speaker for the session, Dr. Given Monga, who is a research fellow from Ludwig Maximilian University, LMU in Germany, and is also the co-lead of Planetary Health Eastern Africa Hub, and is also an expert in planetary health education and planetary health policy advisor for the Eastern Africa Hub. I humbly welcome my colleague, Dr. Given Monga, to share with you his project idea on the topic of transforming food health systems and policy development in planetary health. Welcome, Dr. Given. I hand it over to you. You're still on mute. We can't hear you. You're on mute. I don't know if there is a technical issue from your end. Okay, maybe I request the technical personnel from Tehran to support in unmuting Given, please. The host can help
meeting
Given.
in progress. We are hosting Dr. Given.
Just a moment, they're trying to solve it.
So the admission has been given to you. Is it okay, Dr. Munga?
He can't unmute himself. That's the problem. So if the main host can unmute him, that would be helpful.
So please, I mean, if you have our voice, Dr. Munga, please exit the room and enter again.
Sorry for that technical issues. Let's just given a few moments. In the meantime, if there are still questions for our earlier speaker, Selina, please paste in the chat.
Miss Oceana, don't worry. If there were any questions in the chat box, I will let you know. So
Okay.
don't be distracted for that.
Yeah, Melvin, I would like to ask, meanwhile, what were your thoughts about planetary health communication? Thinking about your experience back in Kenya, having the Eastern African hub, how did you communicate with your community to engage them to take action for planetary health? Thank you.
Yeah, thank you so much for that question. Just to answer, we did more of communicate through like offering lecture series. We started off by offering the lecture series on planetary health. And during that time, because we initiated the hub back during the pandemic, so most of the activities were done online. So that's how we ended up mobilizing and communicating this. But also we are trying as much as possible to communicate also through our research findings. So in the process of doing research, we always try to disseminate back to the communities that we are focusing on a specific research. Especially for me, I've done lots of research on nutrition and aquaculture. So we had to go back to this community and organize workshop and share our research finding. And also strategically through the Campus Ambassador Program, the youth engagement forums, you know. So they are always trying to communicate planetary health through working closely with the community. So now that Given is here with us, maybe I'll allow him now to continue with his presentation, and I will highlight more about Planetary Health Eastern Africa Hub later. Thanks. Welcome back, Dr. Given.
Okay, thank you so much. And if I'm thrown out again, I'll use a different laptop, and then I'll ask Melvin to share with me from there. So I'll briefly talk about transforming food health systems and policy development in planetary health. And I declare already that I have worked very, very closely with Provin over the years from the Eastern African Hub, and she'll highlight some of the things that we've been working on. And I see a lot of familiar names here. This is good to link up here. Thanks to the initiative to hosting this conference, and also the nice presentation from Selina. I have learned over time that sometimes as we seek for answers to the complex questions, to the complex issues in life, we should also be asking ourselves if we are asking the right questions. And as I was preparing for this presentation, I was asking myself, what could be the right question to ask? Is it about why planetary health matters in food systems, or why food systems matter in planetary health? When you look at it from both sides, then you agree that there is a lot of complexity in all this. And this is not to push us back, but then to appreciate that we also need this kind of thinking outside the box to resolve some of these complex matters. So if you look at policy, food systems, and planetary health put together, you realize that we have come a long way in terms of how we have tried to address the question of sustainability. Selena was talking about how do we even communicate this, but starting from the point of sustainability, I think there have been a lot of initiatives over the years, moving from the realization of how we should take care of the health of the public with the concept of public health. Also realizing that the public health matters are not confined within boundaries. These are global matters. And then we look at the global health aspect of it. And then we also have, this close interlinkage between human health and animal health, which must be emphasized over time, even as we look at food systems. And these are the concepts that we look at One Health. But there's also this bigger umbrella of planetary health, where we look at the entire ecosystem and how nature and man are so interlinked, and that the human health is dependent on a health ecosystem. So this is kind of the umbrella that then we look at. I'm pretty sure that by now these concepts have already been looked at in depth. And I just put this slide to say that even as we look at sustainable food systems and how we can transform them into a very sustainable manner, then we should look at this bigger picture of how do we sustain, how do we ensure that there is enough food, but also this is done not at the expense of the ecosystem, because humanity depends on it. I highlight a few things about why this topic is important, because you see that this has been demonstrated already, that if you look at diet, it has this correlation with life expectancy. So this is indicative on the graphs that are here of how the number of years of survival or life expectancy, its correlation to the intake of calories, or the calorie intake. And then you see that with increase in intake of calories, then we see also an increase in terms of life expectancy. On the flip side, also on the right side, you also see how the prevalence of undernutrition also is related to how much calories populations consume. So I lay it over here on the table to discuss, or rather to consider, that actually our diet is very important, because it has this correlation even to the human survival itself with respect to our life expectancy. I move forward to also indicate that we have a problem, ladies and gentlemen, because then we see that in terms of the distribution of the food and how much is taken, there are a lot of inequalities. Still, we have more than 9 million people annually who die out of starvation or lack of food. We have millions, more than 40 million people in over 38 countries across the globe who are at risk of hunger crisis, and 1 in 10 worldwide do not have enough food to eat. And then we see that over 1.3 billion people can afford health food. And it's a cause of 45% of deaths in children who are under 5 years. Also, we see that over 75 million children go to school on an empty stomach. More than 150 million people miss essential nutrients. I laid here, ladies and gentlemen, that then this is a cause that we should have a session to discuss here as well in our conference, because this is important at a global level. We see that also on the flip side of the same coin, I was talking about inadequate food, but we also have more food consumed, which leads to obesity. And we see that it's around 5th leading cause of death worldwide, and responsible for about 4.5 million deaths each year due to obesity. And we see that about 80% of all global deaths, that's an increase to about from 4.5 in 1990 due to obesity. And we see how on the left side, how the increase in consumption of food and the diseases that then are related with this. So we see that also overconsumption of food is also a risk factor to a lot of illnesses and diseases. Issues of overnutrition or obesity in adults, we see that 2.6 billion people worldwide are obese. This is a problem, and if we let this trend to continue, 50% of the global population will be obese by 2050. And so we will have this, what has been called double burden or triple burden of malnutrition, where we have obesity and undernutrition as well. But what we should also put into account is that we see a lot of structural inequalities where a number of indigenous population are more affected, and that this food insecurity is 10% higher in women than it is in men. We see that it even goes up when we have pandemic situations like the just ended COVID pandemic. So we see also this disproportionate effect of food insecurity across the global spectrum. But then I mentioned that we should then discuss how or consider how we can sustain food systems without harming, the ecosystem, because then we have obviously by now discussed how the two are interlinked. And we see that actually in the whole production of food systems, there's a lot of carbon footprint that begins to affect our ecosystem. The food system contributes to about 30% of global greenhouse emissions, and about 15% of global greenhouse emissions attributed to animal sourced foods. So then we see that then agriculture or food system production is an essential component that we must also take into account in terms of how much contribution it is making to the global greenhouse emissions. In terms of then the carbon footprints within the food systems, then we see here the graph that just indicates the amount of carbon emissions from the various productions. And obviously, as you already know, we see that from the beef production, part of it, then we see a lot more carbon footprints, and much less from the legumes like the nuts, potatoes, and bananas, as it were, they are more on the lower side. Yeah, so we have already mentioned how the agricultural processes of food system production itself contributes to the greenhouse gas emissions. But we also see that the number of things that we should take into account with respect to even the biodiversity loss within the agricultural system, where we see about 1% of the farms that control about 70% of the global farmland, and probably about 10,000 edible plant species on Earth, and human beings have cultivated close to about 6,000. And today we see that at the global level, we have we grow about 9 species. And then we see that even in terms of biodiversity, because of increase in land degradation and mechanization to increase agricultural production, we see a contribution from the agricultural part to the loss of biodiversity. So then in terms of how do we create food security for the future, we still have to take these things into account. If you look at the climate crisis itself, soil degradation, biodiversity loss, these also are a major threat to food security itself, because it's been documented that if you look at the loss of essential pollinators, these are eventually causing the loss of nutrition content of some of the foods that are cultivated. So by estimations are that actually by the year 2100, 30% of agricultural land might be unsuitable for agriculture. Livestock cultivation will be impaired, as will be the output of fisheries. So there is really need to ask ourselves, how do we then create policies that will safeguard the entire food system production to ensure that the sustainability, we reverse this biodiversity loss. So we see this negative or loop that feeds into itself. If you look at the concept of farm to fork, for example, and everything that happens in between, when you look at the inputs in agriculture, soil, arable land, water quality, weather pattern, temperature, ocean acidification, these will impact food supply itself in terms of agriculture, livestock, aquaculture, the processing, transportation, as it were. This also impacts on the food environment, the quality of available food, the safety of the food, and affordability because of the transportation aspects of it. This then also is related to consumer behavior in terms of what foods they like, the preferences, the storage, loss and damage, acquisition, in the preparation of food itself. And all these, ladies and gentlemen, then will lead into outcomes that are related to nutrition outcomes, such as malnutrition that I have indicated in the preamble of my speech, the chronic diseases, foodborne illnesses, and all. But we also see that this is related to the greenhouse gas emissions, air pollution, depletion of natural resources, as it were. And then this feeds back to how then the quality of the environmental inputs that are required in the production system then plays through. So you see that this is a whole system that fits into each other, and we must intervene at every stage to ensure that we can create a sustainable system, as it were. So as we make interventions at various levels, we have to be we have to take into account other silos that contribute to all this. So from the health sector, we may be interested, in terms of the disease burden, the nutritional outcomes of our patients, and all that. But these could be related also to the quality of food that they are consuming, the nutrients that are in the food, the nutrient content of the foods that these patients are taking. Here, I just try to highlight that there is a lot of cost attributed to agriculture and a lot of subsidies that then have been put into this industry by countries to ensure that there is enough production of food to sustain the huge population that we see. But then there is little emphasis to also ensure that there is also money set for the environmental remediation, and also to ensure that this agriculture is done in a sustainable manner. So then it's just on one part, really putting more money to increase production at the cost of the natural systems. I highlight here, ladies and gentlemen, that we also see that our current food system is unequal, it's unhealthy, and it's also one of the biggest drivers of the transgression of the planetary boundaries, as it were. And we also have a threat for future food security, which then would lead to a lot of stunting, malnutrition at a global level. And this will make it impossible to achieve a number of sustainable development goals, global commitments that we have made and strive to achieve. So really, we need to rethink our entire food system so that we can transform it to ensure that we can produce food and still within the planetary boundaries, but also encourage that to produce food and the consumption thereof of foods that are good for the health of the population. We must then take into account a number of factors, such as the reduction in food loss and wastage. Cutting loss is very, very crucial if we are to achieve environmental sustainability and a couple of SDGs. So food security is important, reduction in food loss and waste reduction, and also we have to really rethink the whole concept of socioeconomic development, as it were, so that we can, have this sustainable environmental and environmental resources. Other things that we should encourage in terms of having this sustainable food system is to have to transform the whole agriculture aspect, such as the introduction of crop covers, crop rotation, agroforestry, and all that, and also implementing policies that would reduce reliance on fertilizers and pesticides. We help to restore nature and biodiversity, and using of some of the indigenous species, as it were, that could be more resilient to diseases. So there's huge potential from the food production part, that if it's done well, we can cut number of the greenhouse gas emissions to about 20%, and we can also contribute to the reduction. We can halt biodiversity loss. We can restore health soils, so carbon storage, and also we can reduce inequalities in malnutrition, and thereby reduce or prevent to over 11 million premature deaths that are related to poor nutrition. So to do this, we must make deliberate shifts in our policies. Think of how we can encourage eating enough food, but not only that, but also the right food in terms of the nutrient content as well, because there's also a lot of micronutrient deficiency within our patient population. We also have to rethink what it means for environmental health, the land use, the soil quality, the use of fertilizers, herbicides, and all that. We also have to really think about the animal health welfare. What is the moral imperative from the human population? Is it just to produce more for the consumption of man, or we also have obligations to ensure that we can have a sustainable ecosystem? We can also contribute, rethink how the production is done to ensure that we reduce zoonotic disease transmission, because we also see that even in the aspect of microbial resistance, there is a lot of this resistance that is attributed, to animal production that ends up into the human population. So if you look at then even how much is consumed, over time, the lifestyle has changed. There's more sedentary lifestyle, but in terms of the estimation of food that is to be consumed, it was always estimated, from a lifestyle of a very active person and the like, but now this has changed. So we have to rethink this, how food is prepared, not highly processed. We need less sugar, less fat, less salt intake, and with this kind of food, the lifespan could be approximately around 80 years, if this is the kind of food consumed over someone's life. And also the other benefits from this is that you see there will be less NCDs, the non-communicable diseases such as heart disease, cancer, and diabetes, as it were. Yeah, so we see that over time, there's been a huge change in the food systems. Now we have more processed food, even the variety of foods that are produced. For example, to maximize production, new varieties have been produced. If you check now the type of bananas that we have in Europe, for example, they have changed over time, because then we want resilient varieties that can be produced at mass scale and all that. But these also put pressure on the indigenous varieties that are there. So we really see a huge change in the consumption patterns. We have less fresh foods that are consumed now. There's a lot more frozen foods which are actually unhealthy. So we must encourage more local production of foods, much as possible, encourage fresh food consumption. But obviously this has implications, because then the fresh food will be more costly compared to, you know, processed and frozen foods, as it were. So these are some of the inequalities that then we must discuss at a national level, at a global level, to ensure that how do we then address these inequalities? How do we then ensure sustainability, affordability of food, to ensure that then our human population can consume correct kind of foods. So then this brings the concept of the planetary health that probably already introduced by previous speakers, where we want to really look at how do we have, you know, encourage consumption of food that whose production does not lead to you know, environmental degradation and all that. So there's the whole competing interest of land use for agriculture versus the increase in population. So then we increase crop production and also in the number of food products that are being produced. But we also have to be considered in terms of what type of food is eaten, in terms of, you know, dietary diversity, and also the processing and packaging of these foods. I've also indicated already in terms of how, you know, frozen foods would not be good. So we see that there's this huge increase of you know, land being dedicated to agriculture, and this is affecting the balance of the ecosystem. And yeah, so I've already spoken to this, where we have to reduce, or if you look at the recommendation of how much calories someone eats, and or how much salt are to be in, how much fruit is to be in, this is what we must encourage, because this has an effect in terms of the human health, a number of diseases, you know, through high sugar content. You could have issues of diabetes. If you have high fat content, especially saturated fat, you have then heart diseases, stroke, high blood pressure, and cancers due to the consumption of red meat, alcohol, and carcinogenic additives, as it were. We also have, you know, the pressure in terms of the impact of the animal health, poor animal welfare, because we want to increase production of animals. There's overcrowding, stress, and all that, poor hygiene that's leading to a lot of diseases. And then we see the use of antibiotics, and then this is also inputting into the microbial resistance in the human population. I'm getting to close to the close here, Melvin. But also we see there's increase in the cancers because of then the tissue forcing in animals, and also amongst the human consumers. So we then have to rethink all these things. And when we look at maybe in the context of our gathering here as nurses and midwifery, then we must rethink even the education system. How can we bring these ideas into practice, such that we can encourage, you know, some nutritional changes, even for you know, treatment for cancer patients, for example. So how do we embed this kind of the ideas of planetary health education in nursing and midwifery? So we must then advocate for the inclusion of planetary health and sustainable nutrition in health science education, the linkage of nutrition education to clinical practice, the practical training in dietary assessments and the community nutrition, taking into account, you know, the culture sensitive issues, so that the approaches can also be sustainable, because they will be acceptable within various contexts. We must also foster collaborative efforts to promote health and equity and planetary sustainability. I want to thank you so much for your attention, and I hand over to our moderator, my friend Melvin Otieno.
Thank you so much for that amazing presentation. I would just like to ask the audience if they have some questions, maybe to share in the chat so that you can read them through. In the meantime, I have one question based on your presentation. In your own opinion, how do you understand the food choice in terms of transformational food system for health and planetary health? because there's been a debate going around here in Germany concerning planetary health diet, because they want to switch more to vegan or vegetarian diet, for example. While whenever we have this debate with colleagues from Africa, especially during our summer school program, for example, there was this debate that in Africa setting, people still are not ready to switch to plant-based diet officially, like completely, rather than still focus more on the meat-based diet. But also on this topic of meat-based diet, there is also a debate between red meat versus the white meat, especially with the from poultry, because there are a lot of GMOs going on, like modified meat and also other products. And there's this high discussion also in the African setting. So what is your opinion about understanding the food choices, for instance?
Thank you so much, Melvin, for that question. It's a very complex question because once you put the human being into the equation, humanity, we have the autonomy to choose what we think is good for ourselves, but then we must get to this space and also ask what is good for us and also what is good for nature. In terms of the animal-based diet versus plant-based diet, I think it has already been demonstrated. If you look at the core benefits, obviously for your own or for our own good health, the plant-based diet is good for health when you compare it to, say, animal-based diets and all. So this is crucial, and I think this is the messaging also, which Selena mentioned. How do we sell this out? I think we start from a point of core benefits. This is not just good for nature, that you go to eat more plants because we don't want animal production, but this is actually good for your health as well. You reduce cancers, NCDs, and as it were. So this is good also for human beings. When you bring the question of different contexts like Africa, I think then the question is very, very complex as well, because then there's also the issue of undernutrition in some contexts in Africa. So then what does it mean in these settings? But also if you flip it back to the European side, I think what makes the people's choices, for example, and I think it has a lot to do with changes in lifestyle as well, where we see now there is a lot of working mothers and the entire family is working. There's no much time to prepare fresh foods and the like. So then the easiest alternative is to look at prepackaged food, processed food, as it were, and also the prices attached to this, because then the fresh food is much more expensive. So others would prefer in terms of the choices based on cost, as it were. So now this is why we need to have this discussion also at a policy level. How do we ensure that we promote sustainability, but also we break these inequalities to ensure that then the right diet is affordable? How do we create in agriculture incentives to ensure that there is true affordability of the right kind of food? Yeah, so it's a complex thing, but I started from the point of saying human beings have the right to choose what they want. So we must then advocate using the right communication strategies of starting from a point of core benefits. This is good for you, not just for nature, but it's good for you and nature, as it were. I hope I have addressed, or at least tried to address, your question.
Yeah, thank you so much for that. There is also one question in the chat mentioning that a healthy lifestyle for some people is also unhealthy. But in addition to wars, pollution, and poverty, these are all negative effects. So how can we improve the healthy eating for patients in hospitals, for instance?
Yeah, this is good. Yeah, so I run a course. I talk about all these things, the complex nexus of instability in some regions, how it feeds into these food insecurities, as it were. So I talk about this in a course at the University of Munich in Germany. So this is a very complex issue, because we now even see migration and all that could be related to wars and instability, but also that are related to climate change, as it were, and how also the loss of food production could lead to these tensions within some communities, and also this is we call it a violent nexus, if you like. So this is true. Wars leading to pollution, poverty, and or if you look at from the African perspective, that Sahel region, very unstable region with a lot of wars and all that, is one of the regions in the world with the highest also levels of poverty, malnutrition, and also you see the violence that comes with war. Yeah, in terms of then encouraging or improving the nutrition of our patients, and this is very crucial. Probably this is where, you know, the nutrition education could also be enhanced, even as we are caregivers in the hospitals, to ensure that we encourage the consumption of not just the right foods, but also the right amounts of food, because there's also, you know, overfeeding in many cases, as it were. So this could be the point of care, a very nice point to also educate our patients. So that's why it's very essential that we can discuss here as caregivers to say we must also have this knowledge so that we can enhance this education at the point of care, to say what kind of nutrition would we encourage for cancer patients, what kind of nutrition should we encourage, you know, for breastfeeding mothers, and various categories in geriatrics and all that. Yeah, so this is crucial. So we are essential to be part of educators. We must also be educated to ensure that then we can use the point of care as also a point of education for our patients, so that we can improve the health and eating habits of our patients and population, as it were. Thank you so much for that question, Mitch.
Thank you so much, Dr. Given, for your wonderful presentation. I will end our session here. Just to summarize that based on the initial presenters, it is really crucial that we learn the health professionals, these are the midwives and the nurses, are really major contributors to the health resilient systems, and they are trusted leaders and providers of the healthcare. And as advocates and also change makers in impacting the world, we need the support of planetary health researchers who can draw insights from policy research, implementation of the science, and also the topics of food security and all, in order to provide overlapping and also distinct approaches to address the gaps between the evidence, policy, and practice. And also, just to highlight, we need to communicate. So I will welcome the